Welcome to this short video on personality disorder. This is the 5th video in the series, and this is a resource for healthcare practitioners. In this session, we're going to learn about the general treatment principles for patients with emotionally unstable personality disorder, also called borderline personality disorder. I'm Dr. Krisha Patel, and I'm the mental health lead for the company. In this session, I'm going to go over the following general treatment principles: motivation, consistency, and collaborative therapeutic relationship and psychosocial interventions. In session 6, I'm going to go over the final 2 principles of self-management and crisis plans. The principles that are applicable to you will depend on the role and the environment you work in. As an example, I work in police custody where people get arrested, I assess them, they get released and I never see them again. The interaction is brief and fleeting usually. But if you are a counsellor following a sexual assault and you see the patient on a more regular basis, then these principles may be more applicable to you. So let's start with motivation. The majority of patients with personality disorder are what we call treatment resisting. That means they don't want treatment and they're not seeking treatment. For those who are treatment seeking, motivation levels vary and effort and persistence is required. As a general treatment principle, healthcare practitioners should aim to encourage motivation in our patients with personality disorder. Examples of this include using discontent and unhappiness with the current situation to build motivation for change, instilling hope and being optimistic, providing the patient with some psychological education about their condition, informing them that psychological treatments are available, and explaining to them that there is evidence that personality disorder can improve with age. Other ways to encourage motivation include exploring the pros and cons of change, exploring if there's any fear or ambivalence about change. And one of the most important things is encouraging patience and persistence. Personality disorder is a chronic mental health condition, and it's not going to be solved with a short course of therapy or a short course of medications or a hospital admission. Improvements can be very slow. Therefore, it's very important to encourage the client to be patient and persistent. Many patients with emotionally unstable personality disorder have limited experience of a consistent and reliable relationship. Having a reliable and predictable therapist or key worker can be the consistent relationship that the client has never had before. The therapeutic relationship between the therapist and the patient is a very special kind of relationship. There are different types of therapy that are suitable for patients with personality disorder, and they're generally long-term therapy. And obviously staff do change jobs or take time off work, but these transitions need to be carefully managed for the client with emotionally unstable personality disorder. And the client needs to be informed as far in advance as possible if there's going to be any unpredictable changes to the agreement made between the therapist and the client. Collaborative therapeutic relationship and psychosocial interventions. So various psychological therapies are shown to be effective for patients with personality disorder, and these could be one-to-one based or group-based, and they tend to be long-term therapy-based, lasting several months rather than short-term 6-session CBT, which stands for cognitive behavioural therapy. Effective therapy is done with the patient. Therapy, of course, is something the client needs to engage in. It's not possible to just give therapy to a person in the same way a doctor can give medication to a patient. The patient needs to be an active participant in the therapy. And sometimes people are not ready to engage with therapy. That could be due to a chaotic lifestyle, or they're just not able to commit to long-term therapy for whatever reason. And in these cases, the patient may have to wait until they can really commit to regular sessions and wait until they are ready to commit to therapy. Therapy is only useful if the patient is ready to commit, attends regularly, and is willing to engage. There needs to be a shared understanding of the roles and responsibility of the therapist and the patient. So the therapist agrees with the patient to be reliable, consistent, to be present at a particular time, place, and day. And in return, in the initial agreement, the patient agrees to turn up and engage. And that forms some kind of shared understanding, like a verbal contract or agreement. Another very important aspect of therapy is boundary setting. Once dates and times are fixed, they shouldn't be changed unless absolutely necessary. So that way, the patient knows they can't just turn up an hour late for their appointment and expect their therapist to be available, as the expectation is for them to attend on time. So if they turn up 5 minutes to the end of their appointment, then their therapy session will only last 5 minutes. Because that was what was agreed in the initial contract between the therapist and the patient. And obviously a therapist can't just turn up an hour late and expect the patient to be available for them. So it works both ways. As per the initial agreement, if the patient turns up on time, they should expect the therapist to be available, predictable, reliable, and consistent. And sometimes patients with emotionally unstable personality disorder want to push those boundaries. But the importance of keeping the boundaries cannot be stressed. And it may well be that during the therapy itself, the patient learns about appropriate boundaries in life. In session 6, I'm going to explain the importance of the final 2 principles on this slide, which are self-management and crisis plans. Thank you for listening. If you found this video helpful, please like, comment and subscribe, and don't forget to check out the other resources on my channel.